Hi, my name is Lisa Kanata, and I'm the Corporate Director at Martin Memorial in the Learning and Organizational Development Department. And I'm out here in front of the Martin Memorial North Hospital talking to you about an emerging leader pilot, which we just are getting ready to graduate 11 new RN participants from, who are going to be ready and willing to take on new leadership roles here at Martin Memorial. I'm going to tell you a little bit about that program in the next few minutes.
For many years, we've been looking at developing staff nurses at the bedside to become future nursing leaders. We just never really had the opportunity to do so. We're a program that would work for us, and we were fortunate enough to be the recipient of a grant from the William and Helen Thomas Trust this past year. We brainstormed, prioritized, and felt it was really time to look at how we can develop our staff from within who had voiced and expressed an interest in becoming leaders, but they really weren't prepared to assume that role without formal training.
We started the Emerging Leader Program as a result of some interviews that we conducted at the director level, and our internal candidates were not as prepared as we would like them to be, and it was partly because of exposure to never being interviewed. But when we did a skills assessment, we also found that there was things within the organization that they didn't understand.
Our first program was done for nursing, and we interviewed and selected 11 new novice nurse leaders or leaders that have potential to become leaders within our organization. And these 11 nurses went through this journey together. They were each paired with a mentor, and their direct leader also participated in the support and feedback of growing these individuals to ready them for leadership positions here at Martin.
The Emerging Leader content came from, we looked at different programs, but the American Organization of Nurse Executives, who is a national organization for nurse execs, of course, had a very sophisticated and eloquent and meaningful program for aspiring nurse leaders. So we looked at the content and really felt it met all three domains that we wanted to cultivate. That was the business management skills, the leadership skills, and personal development skills as a leader. And with the retirement age of our nursing staff here at Martin Memorial, it was really important, especially the retirement age of nursing leaders, that we start now to plan and prepare for the years ahead.
The Emerging Leader pairing for the mentors came at the request of, first was the student themselves. They asked for a particular mentor. We evaluated where that person was in their learning process within the organization, and then paired the groups together.
Throughout the program, the participants have shared with me that the invaluable relationship they've had with their mentor and with their direct leader becoming a mentor figure for them was just a wonderful opportunity for them to network, to grow, to understand so much more about their unit and their department than they ever did before, really stepping inside the world of their leader and their mentor.
What I gained the most from the program, I believe, is a new appreciation and perspective on current leadership and the tools to hopefully perform a new role at Martin Memorial in the future.
I've learned that from the program that effective leaders build effective relationships with their employees to obtain organizational and unit goals. Also that many great leaders are known to inspire, engage with their frontline workers.
I also found it very valuable, the coaching that was done each week. We could not only address what was in the sessions, but we could also address very specifics of something that came up that I had to address during the week, talk about strategies of how to, what she's done in the past that was valuable, and I'd kind of combine that together, and then the following week we could follow up and kind of go over how everything went. So it was a great sounding board and really like a hands-on learning that I felt really strengthened my choices and the activities that I did throughout the week.
I was able to talk about all the things that we discussed in class: finance, human resources, leadership, all those roles, and be able to get a different perspective from the main nursing area that I'm in, because she's in risk management, and getting a different perspective was very very, very good for me because I was able to see another point that I was not able to see in nursing on a day-to-day basis.
I approached the mentor experience by really looking at this as an opportunity for both Kim Cox and myself to learn about one another. So while I was hoping to provide her great insight from an executive system perspective, I was looking forward to her providing great insight from a nursing operation leadership perspective.
The most valuable thing I thought about the mentor relationship was really the interaction that we both had, learning from each other. I had an opportunity to review the curriculum with her when she talked to me about what the content of the program was, and it was a good review for me. I learned some new things, and she shared with me her thoughts about what she was learning, and you know, it was a good review for me, and I did learn some things about the program from her that I would love to take the program myself.
It has given me the ability to help not only another nurse maybe fulfill her dream of becoming a future leader at Martin Memorial, but it's also been beneficial to me because I've been able to learn from her as well from some of the things that she has shared with me through the program. So it was really a dual learning experience for both of us.
The participants also have shared with me week to week that they have really enjoyed the online curriculum, that it was thorough, it was areas that they knew nothing about and really helped them gain and understand finance, human resources, quality, all kinds of things that you don't know.
The online modules were fabulous. There's probably 8 altogether. It was worth 40 CEUs, and it was great because you could work at your own pace. You could go back and review what maybe I wasn't able to get in the first reading. It covered finance, which I have no background in. It covered human resources, which I have no background in. It was an introduction and an awareness that I didn't have before.
The most valuable part of the weekly training sessions was the interaction that we were allowed to have with the other leaders in the corporation. It was interesting because our peers were from all over the organization as well, so there was a lot of feedback from different areas, and you were allowed to bring up concerns that you had and get ideas from the other participants in the class.
What I wanted for my mentee, the experience I wanted him to have, was more from a hospital administrator perspective. So we did a bunch of different field trips. We went to facilities engineering, where he got to see the house-sized generators that run the facility, the chillers, and all the infrastructure behind the hospital.
It's made me look at from a global perspective because it's introduced me to a lot of different leaders that are in different areas that I'm not normally exposed to. So they were able to show me things that now I can use and bring back to my unit and help be more effective there.
The program also really supports and aligns with our CARE values of collaboration, accountability, respect, and excellence that we feel are the pillars of strength here at Martin that allow us to deliver performance excellence to our patients and deliver the best care that we possibly can.
My hope for the emerging nurse leader participants who will be graduating is that they have really found what they're interested in as far as what they feel they've achieved through the course, and then maybe there's other courses or training or education they may want to pursue even more after the emerging nurse leader to prepare them even more, but that they would be interested in leadership positions, whether it be entry level or director positions. There is already charge nurses in this group who probably will aspire to be directors and above. As I said before, there's going to be lots of opportunities at Martin Memorial in the future, especially with the build out of our Tradition campus, Tradition hospital, and other service lines that we have that we're growing and developing.
Overall, the Emerging Leader Program allowed me to think outside the box and gain a new perspective on hospital management as a whole.
The sense of empowerment that I got, just knowing that now I'm able to lead people. I believe I already possessed an innate sense of fairness and compassion and what I needed. And this program has given me the opportunity to get the technical training necessary that I can use it to actually lead people to want to achieve more, and like I've been able to do.